Today we're going to talk about a company which is into the products that can be very helpful, especially as our generation coming to an advance. Yeah, so we're going to talk about pharma company. So they manufacture medicines which can save you from a wild night. We're going to talk about it how.
Basically, is the savior for people who commit drunk mistakes.
And also they destroy the people who are not in the world yet, so that's there.
Oh,
It had a kind of a roller coaster ride since it listed and it's currently trading at around 170, which is still like 15% down. We're going to discuss why it was a laggard, what happened with it, why it might be a time to have a good look at the company since it might be on the cusp of a turnaround. Hi guys, we're back for another podcast. This week, our old duo is back, and due to I think
hello, guys.
the weather, unfortunately, the weather is not good, so we have to work from home only. क्या पानी
Yeah,
वानी का क्या scene?
back to the basics, the online scheme of
Yes, but I
things.
think yeah, just temporarily. From next week,
Yeah,
hopefully, we'll switch back to our offline mode. So it's a very rainy weather. Hopefully, everywhere it's India, it's the same thing. I think, right? So
वो
and
तो,
it's
and then I
also
think there's
the
some alert also, specifically for Gujarat for the next
Hmm.
5 days.
The western region, I think, whole of
हाँ,
India. That's yeah. And people also tend to be very sick in this kind of environment. So we thought let's just explore a pharmaceutical company in the
definitely.
process. Yes. So today we're gonna talk about a company which is it's into the products that can be very helpful, especially as our generation is coming to an advance. Yeah. So we're gonna talk about pharma company named Piramal Pharma Limited. So they manufacture medicines which can save you from a wild night. We're gonna talk about it how.
Basically,
And
Piramal Pharma is the savior for people who commit drunk mistakes.
yep. And also they destroy the people who are not in the world yet. So that's there.
Oh,
So actually we're talking about the IPL, the yeah, basically you guys know it. So the company, let's just switch back. It had a kind of a roller coaster ride since it listed back in I think kind of a demerge, not listed, but yeah, back in October 22. So it listed around 200 rupees per share and it's currently trading at around 170, which is still like 15% down, 15 or so percent down from its listing price. So we're going to discuss why it was a laggard, what happened with it, and why it might be a time to have a good look at the company since it might be on the cusp of a turnaround maybe. And yeah, we're going to explain how it went through the rough patch that it used to, and then the going forward how it looks. So first of all, what does Piramal Pharma do? So it's basically a company that deals with everything from life-saving drugs to life-destroying drugs to everyday wet wipes. So,
बस यही तो मैं मिस कर रहा था, इसलिए वापस आ गया पॉडकास्ट के लिए.
but it has a pretty good global presence. So, and also it provides your typical CDMO services. Also, they have something called as CHG, which is consumer healthcare, which deals into the basically hospital generics, the product like inhalation anesthesia and everything. And third segment is there, which is Indian consumer healthcare, where they are OTC products like your skincare routine or nutraceutical or healthcare, something like that, and the eye pill that we're talking about. So, and also
Okay.
wet wipes they make. So, yeah,
So just a
I
second. So
think they are.
you just mentioned a lot of products. So basically, they are
Yeah, yeah.
into three divisions. I'm just trying to sum
Yep.
it up.
Yep.
One is the Piramal Pharma
CD.
Solutions, जिसमें they do the CDMO thing. So
Yeah.
just talk a bit about CDMO and
First. Yeah.
so talking about CDMO, I had a question. Abhi, for
Hmm.
CDMO, you have to have the bestest of safety standards. You have to adhere to the
Yeah.
US FDA standards, which I'm sure they do.
Hmm.
But
Hmm.
US FDA has a reputation of, coming again and again, visiting the
Exactly.
what faculty, sorry, the
Hmm.
factories of the companies again and
Facilities.
again,
Yeah.
facilities, yeah.
Yeah.
So if you could just
Hmm.
tell me how is the company's track record clean on that particular front or no?
Hmm. Good that you mentioned that because CDMO is particularly important for the company because you contribute almost 60% of the its revenue in FY 24,
Okay.
58 to be precise. So it's actually like a crown jewel for the company's total business. So they first of all they provide everything from drug discovery to commercial launch. So for those who don't know might not know this is basically starting from scratch, just knowing what they want to target, which disease to target, to commercial launch means everything. Developing drug, doing all clinical trials. There are three phases of the clinical trials. Before clinical trial, there's something called as preclinical trial, which basically experimenting on
Mm-hmm.
rats or something like that. So they
Hmm.
provide everything under single in-house, single umbrella. That's what makes them a little bit different than its competitors. And good that you mentioned that the US FDA point. I have actually good data handy for that also. So I think since FY 12, which is like last 12 years, company had 42 US FDA inspection, 328 regulatory inspection other than US FDA, like
Mm-hmm.
European regulatory, Indian regulatory,
Mm-hmm.
Japanese regulatory, and 1700 close to customer audits, the client who want to visit the facility before giving them the contract. So
Hmm.
in and around total 2000, 2200 of inspection, and they haven't got single official action indication from those
Or
inspection
any
in the last
observation,
12
dude?
years.
That's
Yeah,
crazy. I mean,
crazy. That's
matlab,
actually, yeah,
yeah.
that's
So,
quality at its best, basically.
yeah, matlab, I mean, there
Yeah.
can't be anything else
Hmm.
to define the quality of the company. Matlab, we have zero
Hmm.
observations, and I think they have been
Yeah.
in existence for what, more than 10, 15 years.
Yeah. Yeah.
That's good, matlab, aisa, maintaining that quality. And
Hmm.
for CDMO companies, I think this is very necessary because they are
Yeah.
essentially trying to
Hmm.
create a new drug, and you
And
need to have
basically,
the
their
bestest of standards.
next big order depend on this. If I'm a
Yeah,
good pharmaceutical, let's say I'm a Pfizer, I want to give a company and a contract. So quality needs to be there for me to give the contract. So I think that's very important.
definitely.
Yeah, and coming next, I think their second business vertical, which they do under the name of Piramal Critical Care. It's a complex hospital generics. Basically, your
Okay.
injectables, anesthesia, pain management, and all those kind of thing. So these also actually they manufacture in house, and they have a network of close to 6,000 hospital across the world in countries like India, in even in England, France and Germany, Europe countries. So that contributes around 30% of the portfolio. And because of their B2B relations and the in-house manufacturing practices, they also be a beneficiary for them because of the good network benefits. And third one, which is literally smaller, only 10-12% of the business, which is your Indian consumer healthcare. Here they sells OTC products basically, which you don't need a prescription for. Pain relief tube ho
Mm-hmm.
gaya, or yeah, simple. They also sell wet wipes and maybe diapers also. So IPL
एक
and
सेकंड.
diaper.
यार, नहीं, बट आई हैड आईपीएल बिना प्रिस्क्रिप्शन के थोड़ी दे देते.
You can get that. I think so. I haven't got it anywhere,
मैं
thankfully.
बस यही बोलने वाला था, लग रहा है एक्सपीरियंस
No,
बोल
no,
रहा
no,
है.
no. But I think you can. It's just a precautionary tablet. It's not necessarily
हाँ.
if you had, let's say, unprotected intercourse, then you might need an IPL. It's that kind of thing.
गॉट इट,
Hmm.
गॉट इट. ठीक है, तो आई थिंक
So,
यू
but the
एंड
I think question
हाँ.
remains, right? The if the company is so good in it, what it does. So what went wrong and why the stock is almost nowhere, or maybe even a little bit down since its IPO? Want to care to
Cool.
explain?
So I'll just talk about it because I think
Hmm.
the company is in good businesses. I mean, and they are leader in what they do because I think IPL maybe they are leader in, matlab in the
Hmm.
precautionary medicine area. They are the leader. डायपर
Hmm.
पता नहीं ये लोग कौन सा बनाते हैं, बट हाँ
No, no.
वो है। एंड देन जैसे तूने बोला क्रिटिकल केयर है, सीडीएमओ में तो आई थिंक दे आर
Hmm.
ग्लोबली आई थिंक टॉप 5 टॉप 10 में कुछ है ये लोग।
In India, they are in top three. So that
हाँ
is there. And India is, I
हाँ तो
think, second biggest market globally after China. So yeah,
ग्लोबली तो
it
मतलब आई
must
थिंक दे विल
definitely.
बी इन द टॉप 10 फॉर श्योर, मतलब
Yeah.
कैपेबिलिटीज है तो। सो या बट देन आई
Hmm.
थिंक व्हाट द प्रॉब्लम वाज, ऐसा नहीं कि कंपनी ने कुछ गलत किया, कंपनी अपने
Yeah.
एंड से तो वो लोग सब सही कर रहे थे, बट व्हाट हैपेंड वाज आई थिंक इट स्टार्टेड ड्यूरिंग द कोविड पीरियड इटसेल्फ। तो आई थिंक कोविड में वो जैसे देखा था लॉकडाउन हो गया, फिर उसके बाद वो रशिया यूके का सब चालू हो गया वॉर वॉर, और वही
Hmm.
टाइम पे फार्मा कंपनीज जो थे जो ऑलरेडी सबने स्टॉक करके रख लिया था, तो इन्वेंट्री के
Yeah.
भी इश्यूज हो रहे थे। तो ये
Inventory
सब
was
और
piling up.
कॉस्ट भी बढ़ गए थे सब जगह पे, कॉस्ट भी
Hmm.
आए थे सबके। तो आई थिंक दीज वर द इश्यूज व्हिच क्रिएटेड issues for the company.
Hmm.
And during
So
this
macro
particular
reasons.
period, हाँ, macro regions. So during this
Hmm.
particular period, ऐसा FY21 से FY24, company
Yeah.
did grow at a CAGR of 9%. Their revenues went from
Okay.
6,300 to 8,200. But the
Hmm.
problem was that this particular growth wasn't enough because of the reasons we discussed as high costs. डेट भी
Hmm.
उन्होंने ज्यादा कर दिया था, तो बेसिकली
Hmm.
इंटरेस्ट कॉस्ट बढ़ गए, रेट्स भी हाई थे।
Hmm.
तो दीज वर
Okay.
द इश्यूज व्हिच क्रिएटेड प्रॉब्लम्स फॉर देम। सो आई थिंक उनका
Hmm.
जो सीडीएमओ सेगमेंट है दैट ग्रू
Hmm.
इटसेल्फ एट अ 7% कैगर, एंड उसका भी मेन रीजन वाज दैट आई थिंक you we were discussing that Piramal का जो
Yeah.
customer base है is
Hmm.
mainly those new age pharma companies who are into biotech and the new technology stuff.
Yeah.
And if
Yeah.
you remember during that period 21-22 startup
Hmm.
funding या जो भी funding होता है for these type of research is
Yeah.
थोड़ा
It was a funding
problem आ गया
winter
था,
kind of season.
या मतलब
Yeah.
फ्रीज कर दिया था। तो आई थिंक बिकॉज
Hmm.
ऑफ दैट जो एंड मार्केट है वही
That
स्लो
also
डाउन हो गया था, सो दे कुडंट
got it.
कैरी ऑन देयर ओन सर्विसेज प्रॉपर्ली। देन द
Basically,
सेकंड
if your
वाज इज
customer
द
don't have money to pay you, then they're
हाँ
gonna stop
हाँ
giving
सही
you.
करोगे तुम,
Okay,
हाँ।
got it. Got it.
So then
Understood.
second was
Understood.
the critical care segment which you mentioned, that same single
Yeah.
digit growth, 8% growth। एंड उसका भी यही
Okay.
रीजन था कि कोविड, तो वो पहले 2 साल जो थे मतलब 21-22 ले लो,
Hmm.
सबका सब हॉस्पिटल्स कोविड में ही लग गए थे। तो जो बाकी की जो
Hmm.
सर्जरीज और करनी होती है उस पे इतना ध्यान नहीं
Hmm.
था, और ये जब वो किसमें
Anesthesia and all
एंड
those, so there's no uses
एनेस्थीसिया
for
हो
that
गया,
in
पेन
COVID.
में, हाँ मतलब या तो बेसिकली
Hmm.
जब हॉस्पिटल्स
Exactly.
का अगर फोकस हट रहा है तो इनके प्रोडक्ट्स तो काम
Hmm.
आएंगे ही नहीं। बट
Hmm.
व्हाट्स ऐसा
Understood.
इंटरेस्टिंग इज जब ये दोनों सिंगल डिजिट पे ग्रो किए, देयर
Hmm.
कंज्यूमर हेल्थ केयर वाला सेगमेंट इट ग्रू एट अ कैगर ऑफ 21%। एंड दैट इज ओनली
Hmm.
बिकॉज द कंपनी वाज वेरी ऐसा aggressive in making new products, launching those new products,
Hmm.
and they were their brand which is
Hmm.
already reputable because they are leaders in in such segments already, so it became easy for them to push the new products.
Hmm.
So that
And
is why
also, I
this
think
grew at a
because
CAGR of 21%.
uh, okay, I think
But
that was also
problem क्या हो
helpful
गया,
because
हाँ
I think people were also in lockdown in home, so they might needed IPL more. I don't know. So that
भाई
an OTC
सा
segment. Yeah,
सर,
please continue. That was the last one, by the
पक्का,
way.
हाँ।
Let's see.
हाँ, and this just contributing
Hmm.
12% of the revenues, it didn't really make a
Hmm.
difference. तो
So
that is
even
why मतलब भले
21%
ही,
growth was there,
हाँ,
just 10%. So yeah,
तो ऐसा
doesn't
फर्क
matter.
नहीं पड़ा। तो एंड यूजर मार्केट में
Hmm.
इश्यूज थे, तो बिकॉज ऑफ दैट
Hmm.
एंड एज वी डिस्कस कि भाई इनपुट कॉस्ट बढ़ रहे थे उनके, तो उसकी वजह से क्या
Hmm.
हुआ, दैट एबिटा डिक्लाइंड at a CAGR of
Okay.
6% from 1200
Hmm.
to 1200 in FY24 from 1430 crores in
Okay.
FY21.
So
And
revenue
to
grew at 9%, but EBITDA
हाँ,
declined at
EBITDA
6%.
declined at
That means
6%. And एक सेकंड,
hmm.
अभी तो खतरनाक चीज ये है कि कंपनी
Okay.
used to make a profit of 800 crores in FY21, but as
Ooh.
of FY24 the net profit was at 18 crores।
18.
18,
Almost wiped
800
out.
से 18।
Yeah.
वही मतलब ठीक है ही नहीं, प्रॉफिट ही नहीं है। but that
Considering
also
that the
was
stock price is
because
not bad.
हाँ मतलब ठीक है, obviously it deserves to get such a crash मतलब, and ये 170 भी अभी recently बढ़ा है, उसके पहले तो वो बहुत नीचे
They
था.
were in loss, I think, at one point of time.
हाँ
FY23 maybe it was, I think, lost. Yeah.
वही तो, and at
So
the
I
same
think
time
main
company.
reason Pat
हाँ.
was, I think, it was destroyed because of the debt, because they did a
हम्म.
few inorganic expansion. There was some expansion in Japanese market. This company called Japan Bio or something. So did some
हम्म.
acquisition, counting on the that they'll get the revenue and everything, which I think uh, it's not that they're not gonna get it. It's just that it got delayed, and that's why because of that the short-term fluctuation was there and the profit took a hit, and then that also went from 2,500 to almost 4,000 at the end of 24 FY24. So yeah, I think that explains the stagnant performance of the stock. But I
वो तो
think
है.
uh, this is where it gets interesting, basically.
हम्म.
So as we said, despite the past turbulence, it's one of the top three CDMO players in the country, and it has around 500 global customers. Very many of them Fortune 1000 companies. So that tells
हम्म.
a lot about the company's clientele. But I think what the CDMO business is particularly going, what happened was so basically low because of the low growth, low base. Sorry, now the growth will be there, and even if
हम्म.
they just get back to the level which was before that, it's gonna be a significant growth going forward. But what additional thing company is doing is they're increasing their patented product portfolio. This is basically if a company XYZ company gives you an order as a Piramal. So and if that product is patented, it has a relatively higher margin because then there's an element of trust and that you have to maintain that you don't have to share that anyone else.
हम्म.
It's a yeah. So basically, it's a higher margin business. So company has doubled that particular product portfolio from FY19 to 18. So almost double in the last
डबल कर
5 years.
दिया.
Yeah. So that also contributes around 10% of the total CDMO segment revenue. So that helps in the margin improvement, and also with the operational efficiency, company has did some cost cutting, basically operational measures that it took.
Measures they've
So
taken.
yeah.
Yeah.
And now the demand also looks strong. So going forward, I think CDMO segment is projected to grow at around 15% CAGR until FY27. Yeah, in the next 3 years. So and has focused on higher margin products, which were like higher patented product portfolio. And the companies,
हम्म.
as we mentioned earlier, how CDMO they offer from everything in house. So that's differentiated offering also makes it a good segment going forward. So that is for the CDMO, I think, which is like more than half of companies. But other almost 40% of business, which comes from consumer healthcare and India consumer segment, that is also, I mean, it is possible poised for growth. I think CHG business, they are currently have around 40 product portfolio. The one we talked about anesthesia, injection, and all those things.
हम्म.
So they have 40 product portfolio, but going forward, they aim to double it. I mean, almost double it because they are introducing 35 products, new products that are in pipeline. It's not on paper. It's different stages of development is there.
तो
So
बेसिकली जितने
and
थे ऑलमोस्ट उतने और लेके आ रहे हैं.
yeah, exactly. And
हम्म.
also increasing that hospital network there. So actually, company is has a very there's this group called US Group Purchaser Organization. So basically, if you are approved by their organization, every hospital under that organization can do business with you without extra scrutiny. Let's just say that. So that also helps company in increasing its hospital network from 6,000, which is currently, and that helps company, I think, for its consumer product business, around 16% for that as well. Growth rate is projected. So that's for that. And of course, the last one, which is very small currently, the Indian consumer healthcare segment. It's also a good player in OTC. Companies also has around 100 products in this particular segment. And they have almost 200,000 network of chemist and pharmacy companies, pharmaceutical stores, and company has something called as Valify that own D2C platform. like we have pharmacy or maybe netmeds, if you might have heard of. The similar thing they also have called Valify, which is around 16% of the consumer business. So almost fifth of the business comes from online. So going forward,
Online.
companies taken in like an omni-channel kind of a thing, growing distribution from offline as well as online. And this is, I think, it grew at 20%, and it is also expected to grow at 20% till FY27 as well. So over and all in all, I think all the three segment of Piramal are seem like they're out of the woods now, basically.
Yeah, I mean we can see recovery, and as you mentioned कि भाई
Yeah,
patented products में घुस रहे ये लोग, तो
yeah.
which which will
They
increase
had
margins and
existence,
at
they're increasing. Yeah,
हाँ, but मतलब yeah, they're increasing their focus,
yeah.
and so basically there is a room for margin expansion also in on the
Hmm.
cards.
Hmm.
And then if you see जैसे जो कंज्यूमर वाला हेल्थ केयर है उसमें एज वी
Hmm.
डिस्कस की भाई ये काफी अग्रेसिव हो रहा है, तो ऑब्वियसली एक्सपेंसेस
Hmm.
ज्यादा होंगे तो उसकी भी प्रॉफिटेबिलिटी कम होगी. So going
But the
forward,
good
once
thing
they
is
stabilize that also.
mm, yeah, most of the
Hmm.
expenses are now done for all these
वही तो
expenses. So the stage is set. For now
हाँ,
onward, I think just growth part is remaining.
so
Yeah,
basically
but
this
but
particular segment can also help in increase
hmm,
or push their margins
exactly.
a bit forward.
Hmm.
Yeah.
But what happened because of the company's underperformance in the past few years, valuation also took a hit. So where industry trades around 15 times EV to EBITDA 1 year forward. So what Piramal trades at around 10 times its 1 year forward currently. Of course, the recent might be stock price rally might have taken up to like 10 to 11. But so there is also that chance. But if everyone sees the company is poised to grow better and everything, so its valuation might be market might award it to a industry average, if not more, of course. So there's that
Got
also.
it.
Yeah, so that slight angle is also there. A valuation re-rating kind of a thing, maybe there. That's an extra thing.
Got
So
it.
I
Got
think
it.
yeah, I think we've covered it pretty well then about that. The
Yeah.
company, what it does, what it
What went wrong
kills.
and what's in store for the company in the
Hmm.
near future. Also, guys,
Hmm.
nothing is an investment recommendation. Please take it as education and entertainment. So yeah,
Or
we had to
any
give this disclaimer.
medical advice is also not here, by the way. You do
Yeah.
you. uh, we hope you take.
Oh, मेरे को अफसोस.
Hope you guys take precaution and you don't need Piramal's product. And that We're gonna end it here. So yeah,
Yeah.
see you in the next one.
Next
Until then, bye
podcast. And
bye.
guys, like, share, and subscribe. Thank you.